Now, with the application of Frederick Myers' criteria for credibility, he established his criteria for scientific credibility 125 years ago. With the application of Myers' criteria for credibility and validity, together with a positive health outcome for the patient, we may be able to provide such efficacy. Any evidence for the efficacy of telepathic hypnosis in the therapeutic environment will continue to be challenged by mainstream medicine. It's therefore important that the evidence presented is externally validated, qualified and viewed seriously by independent research analysts, and by open-minded clinicians who may wish to avail themselves of an additional complementary, I use the word complementary, not alternative, approach for the treatment of their patients' mental and emotional health and well-being. Now, in the first instance, evidence of efficacy, validity, and the therapeutic value of telepathic hypnosis must come not from a biased psychiatric perspective, but from the patient's responses as reported by his family. Further evidence would be provided by detailed analysis, qualitative analysis of discourse between the patient and their carers and family, and with their psychiatrists. And that takes skilled, qualified psychology researchers. Now, I've got all the data, I just need an analyst to look at it. So let's talk about the method of telepathic hypnosis. How is it done? One gentleman was asking me this earlier before we started. I was explaining. I'm going to explain to everyone. Under normal conditions, that's traditional conditions in a therapeutic environment, the therapist and the patient are face-to-face, one-to-one, okay, using conscious awareness to communicate. But in contrast with this method, the application of telepathic hypnosis is conducted through a medium. The therapist, the medium, and the patient are not face-to-face, in direct contact with each other. The therapist will ask the medium, and when I'm working with my colleague, Andrew the medium, again, we live very far apart. I live in South East Kent, he lives in Wiltshire. So we work on Skype, okay? So I've got Andrew sitting in front of me on the computer screen, and I say to him, Andrew, go into a trance and connect with this patient, and I will give the name of the patient, where he is, and how old he is, and that's all. Don't need a picture, don't need any more information. And the medium will go into a trance and he will connect with that patient. The medium can then convey the thoughts and feelings of the patient to me, and he can convey my suggestions to the patient. So the medium is acting in the true definition of the term. He is the medium. He's the one between the two. But in addition to that, and this is where possession comes in to the equation, I can ask the spirit of the patient to possess the medium. And I can have a direct conversation with the patient. The medium's in trance, he's out of it, he's away with fairies. And he'll come back to conscious awareness and have no memory of the conversation I've had with the patient. So I can have a conversation with the patient as if he's sitting in front of me, as you are now. It sounds fantastic, I know, but let's go back to the PowerPoint presentation. I just gave you the scientific evidence that telepathy works.
Does the patient need to know what's happening?
No, let me finish and I'll take questions, but the answer to that is no. We'll explore that further, okay? So, I'm not going to... these case studies. This first case study number 1. The case file at the moment runs for 122 pages of 45,000 words, which is made up of email correspondence between myself and the family and transcriptions, typed transcriptions, word for word, of the conversations with the patient. So there's a lot of material there. Now, this first case is very, very complex that comprised several elements that contributed to his behaviour, that caused him to be hospitalised. And those elements include spirit possession, unsupervised communication with spirits, he was happy to talk to them, and establish friendships with them. It's quite funny, actually. But he was unprotected, and he was making himself vulnerable to negative spirit infestation. And what was particularly interesting about this case is that a past life experience came to the fore, because he was accusing his mother in the most derogatory terms, in the most aggressive terms, accusing her of being a witch. Now, this is a mother who gave birth to him and loved him dearly. So, for her, it was extremely distressing. But further investigation revealed, on the patient's part and on the mother's part, that she was a witch in a past life, and that this was an exercise in karmic rebalancing. So you can see, from my point of view, a fascinating case, and I really got involved in the communications with this patient. Now, the skeptic would argue this is active imagination at work. This is the imagination of the medium, and you're encouraging it. All I'm doing is listening. I'm asking questions, okay? I did give some suggestions, the sort of suggestions that you would give to a patient if he was sitting in front of you and you wanted to give hypnotic suggestions to improve behaviour. So I did give suggestions along those lines. But I'd like to go back to what I was saying about efficacy and evidence, using William James's simple pragmatism. Does it work? Is it having an effect? Is there a positive health outcome? Communication from the family. Dear Dr. Palmer and Andrew, thank you so much from the bottom of my heart. You gave life back to our family. Yesterday, we discussed with the hospital, Michael's psychiatrist had invited also a more senior psychiatrist, Michael is a pseudonym obviously, a more senior psychiatrist to that meeting. They told us they'd done MRI and plenty of psychological tests. And Michael reported that during the 3 days of testing, he'd answered over 800 questions and psychometric tests. The psychiatrists and psychologists at the hospital said they're very sorry, but they can't explain Michael's case or give a diagnosis, and they released him from hospital. But he was on medication. He then had to be weaned off it, slowly. 3 months later, I thought the case was closed. But 3 months later, the family came back and said, you conducted successfully spirit release session for our son 3 months ago. He's been at home these 3 months. He does not get treatment or therapy. The psychiatrist couldn't give any diagnosis or explanation after all their tests. But she goes on to say, he's a very sensitive person and he can contact the spirit world. And it seems that his skills are developing further. However, he refuses to discuss these things with me. Now, I could give a lot of information, but I'm going to cut to the chase and say to you that the case is ongoing because the patient, it emerged that in addition to communicating with spirits and being possessed by negative spirit entities who were taking advantage of his vulnerability, he also had a family of dissociated subpersonalities. Now, who knows what I'm talking about? Okay. Clinicians who work with people with dissociative identity disorder, that was previously called multiple personality or dual personality, will know what I'm talking about, or ego parts therapy. So I got involved in having conversations with these dissociated subpersonalities with a view to getting them reintegrated. The problem was there was one dominant one, a 16-year-old that was very aggressive and antagonistic, and if you like, this is your typical 16-year-old challenger to authority. And his family started to call this part the challenger. So it's an ongoing project, but I'm going to read you now an email that I got from the mother yesterday. Because I told her I was presenting this today, and I asked her if she had any comments. And she says, as a family member, I can comment on this technique and its added value as follows. I think this technique is invaluable in situations where traditional healthcare experts are not able to diagnose. I'm convinced about its validity and usefulness. It helps not only the patient himself, but also us, the family members. We're able to support our loved one in the right way when the underlying problem is revealed. So that's case number one. I'm just looking at the time. So with case number one, it's a continuing case of education, learning by the family and the patient. And some may regard this as a case of spiritual emergence. Now, in November of 2016, 3 families came together in a workshop. And each family had a son of similar age who had been diagnosed as psychotic, and they weren't getting satisfaction from mental health services. And they sought help from outside the institutions. So they met together with complementary therapists, and Andrew and I were one team of complementary therapists. There were 2 others. And we were asked if we could help these 3 cases. And this case refers to one of them. This one suffered early neglect by his birth mother, abandonment, was taken into care at 3 months and adopted at the age of 12 months by a very well educated and well provisioned family, professional couple. At the age of 17, as his behaviour became increasingly challenging, and without adequate resolution from mental health services, they asked for help. Well, I'm going to read a quotation now from one of the parents. according to an adoptive parent, he has always been hypervigilant and shows the typical behaviours associated with reactive attachment disorder. That's lack of organisational skills, primitive fight-flight reflexes, low self-esteem, lack of empathy, lying, manipulative behaviour, sensory issues, high states of arousal, short fuse, etc. These secondary features of reactive attachment disorder need a long-term, skilled, therapeutic input that just is not available. Expelled from school, dropped out of college, in trouble with the police, you get the picture. Now, which therapist in their right mind would want to take on this case? But we had a go. And I asked the family if they'd be willing to allow their son to be influenced by telepathy, and they agreed.